is Borderline with your host, Bob Gilmartin. Borderline is brought to you by the International Bank of Commerce. We do more. McAllen Medical Center. Dunkin' Donuts of McAllen. Osment Appliance. The McAllen Foreign Trade Zone. With Chiropractic and Microtel Inn. And now, here's your host, Bob Gilmartin.
Ladies and gentlemen, good morning. Welcome to Borderline on this Sunday morning, and we're glad you're with us because we want to talk about what's going on in the world of accidents and bones and alignment and chiropractic industry with Dr. R.J. Wipf, and thanks for coming over this morning.
My pleasure, Bob.
There's a lot going on in the field of medicine, particularly as it relates to chiropractic medicine. And, of course, one of the focuses of this program today has to be this whole concern that I think many true professionals in the business have about what's going on ethically inside the business. And maybe you might want to begin with an explanation of why you think some of the ethics are out of place for some members of your profession.
Well, here in the Rio Grande Valley, Bob, particularly in the last, I'd say 3 to 4 months, there's been a lot of interest regarding accident report solicitation in that there are just a small number of chiropractors who are using accident reports to solicit patients after an injury, usually within 24 hours. And of the 60 chiropractors who are practicing in the valley, there are only 2 who, by the way, are from upstate, who own, I believe, about 8 clinics in the valley and have doctor employees who are really part and parcel of this type of activity. And the rest of us, of course, are interested in and affected by this accident solicitation. It's the talk of the town, so to speak.
Is this the kind of the flip side of barratry by attorneys going after accident victims for litigation?
Yes.
It's the flip side of, in other words, the legal problem has on one side, and now on the chiropractic side, they get these police reports, but does it have enough information in there for them to warrant making a solicitation?
Well,
because I've seen many of these accident reports, and they list the names of the people who are driving a car, for instance. I'm assuming if there's a pedestrian involved, there would be a name there that might be a possible client. But is there enough information for them to go solicit someone after an accident?
Well, to answer your first question, Bob, it is the flip side of the barratry. To my understanding, attorneys cannot solicit accident victims within 30 days of the accident.
Or have even an agent go after
That's right.
somebody representing them.
That's right. Unfortunately, the law doesn't cover others, and chiropractors fall within that, others along with other physicians. Now, the solicitation was slowed down a bit by House Bill 391, which went into effect September 1st of 1995. And what that says is anyone who goes to a police department and asks for the previous day's accident reports prior to September 1st, they just paid a fee and they got whatever the clerk had. Now they have to come up with 2 out of 3 bits of information. 1, the name of the person's on the accident report. 2, the location of the accident. And 3, the time and date of the accident. Well, that slowed them down a little bit, but from what I understand recently, they're using open records reports to get the radio logs. And with that, they go from the back door to the front door. And
in other words, they don't have to say for whom they are soliciting these reports, right?
No, they don't mind telling you. There's a number of companies that do that, and then from what I understand, they sell these reports to these chiropractors. Now, they filter these reports, and they find which reports, because on the report it does say whether their name and address, the time and date of the accident, whether they were injured in the estimation of the reporting officer, and also whether they have insurance. Of course, if they have insurance, both parties to the accident, if the fellow who
supply the insurance records, don't they?
Well, they have to say whether
they have to have proof that they have
that's
coverage,
right. And if there is insurance, usually then the victim, whoever they assess is the victim in that accident, and that's usually the other fellow who didn't get the ticket. They do give him a call and solicit him.
Well, now let me play the devil's advocate here. Why couldn't somebody look at this and say, this is just smart business development? This is a way to build a practice. I mean, I'm going after public records. These are public documents that are open to anybody to go and pick them up or pay for a copy from the police department. I'm not doing anything illegal, and I'm just trying to build I'm a businessman. I'm looking for clients.
That's right.
And so what's wrong with this?
Well, Bob, that's a darn good question. Now, let me address that, because I'm a good example of that. I have 6 clinics in the valley. We've had up to 12 doctors. Now we have 8. And I've tried just about everything that I feel is moral and ethical for advertising. But as you know, in advertising, the only way you'll know if anything worked is to test the market. Well, about 2 years ago, I was approached by one of these soliciting companies. This is before this ever became an issue. In fact, I don't know of anyone who was doing it. So being on the edge, so to speak, in advertising, I thought, well, I'll look into it. I did fly up to Dallas, and I visited with the representatives of one of these companies, listened to their phone banks, and from what I was hearing, they were calling individuals who had been in accidents from these reports, asking them if they were having any problems, and if they were having any physical or legal problems, they recommended a local chiropractor in their area. So I signed up. I did.
On the surface, that sounds pretty good, right?
Well, the thing of it was, see, I was really concerned because I've had patients come in and say, Dr. Wipf, I was in an accident a month ago. I'm still having headaches, neck pain, numbnesses, weaknesses, and we would look to an insurance company or to the individual who hit them. They would bring in their accident report. Clearly, they were the victim, and we would find out, unfortunately, that they signed away their rights because the insurance agent had offered them $200 or $500 for a quick settlement. They'd signed it under a certain amount of duress or pressure from the
or false pretense,
or false. I don't know if the case could be. I wasn't there, but what I am saying,
that could be a case though where people could be persuaded to sign something when they're under duress, when they're under pressure.
That's right.
That they might not sign otherwise, right?
That's right. And then weeks or months later, days or weeks later, they'd come into my office, and I'm sure other physicians' office, complaining of the symptoms that are very relevant and real.
But they signed away their rights.
They signed away their rights. So I was concerned about that. In being a physician, where it's one of my responsibilities to be a patient advocate, I wanted to do what I could to kind of, short circuit that from happening, so the patient would have an opportunity to talk to me and be evaluated before making that decision to sign away their rights. So this was one avenue I felt was legitimate in doing that. Well, to be frank, Bob, I tried it for about 4 months. This was back in 1994. And it didn't work out. My name's on the door, Wipf Chiropractic. My telephone number's in the book.
You're legally responsible.
I'm legally responsible. I'm superior respondent to everything that goes on in my business. My chiropractic practice is Wipf Chiropractic. It's not ABC Chiropractic, Rio Grande Chiropractic or what have you.
Yeah.
So I started getting phone calls. Now, did it work? Yeah, it worked. And we got quite a number of patients in. But the problem was I was getting phone calls from people who were being solicited, and they didn't like it. About half of them said, Dr. Wipf, you have a reputation, we've heard of you, please don't call us at home, we don't appreciate it. The other half weren't that nice. Well, it didn't take me long to realize that this wasn't working, and it wouldn't behoove me or my profession to continue doing it. So I got out of it.
I'm lost. How did people get the wrong impression about you? How did they get the perception that they didn't want to talk to you?
Well, there are many people who have very minor accidents, and their report doesn't really say that. So the company calls these people, and they're offended by being called at 9, 10 o'clock at night, and being even suggested that the suggestion of even going in to see a physician
or
for
slightly
a screen,
pressured,
or slightly pressured. And, even though any perception at all of being slightly pressured, although the company that I was using, I had heard the accident solicitors, and their telephone talk was, if we can help, here's a local doctor. And then when the individual would say, yes, I think I need some help, then they would tell them it was Wipf Chiropractic.
Now on the surface, that sounds okay, doesn't it? Or
well, initially,
is it just calling too late at night?
Initially, I thought it was too, Bob. But the guy who started Alcoholics Anonymous wasn't a teetotaler, all right? It takes one to know one. So this is one of the reasons that I'm so adamant about this whole accident solicitation, because I saw what it did to my practice as far as the bad press and the criticisms I was receiving. And I could see that this wasn't good for my patients or the community.
Is it possible, though, the media couldn't differentiate, though, between people who are ethical and those who may be on the edge of being unethical? Is it possible the media couldn't differentiate, and as a result, they transmitted to the masses out there this same fuzziness between the ethical and the potentially unethical?
Well, it's gotten to a point where it has become, frankly, unethical. I've had patients tell me, recently, within the last 2 weeks, that they were in car accidents, and they've had up to 12 telephone calls, 6 or 7 of them from chiropractors. Now, what's happened, Bob, there's 6 or 7 groups in the Valley that are calling, so it's become very competitive.
Okay, let's stop on that one point because we have to take a break. Dr. R.J. Wipf is our guest. We're talking about solicitation of people who have been in accidents and may or may not need chiropractic help. And we'll be back with Dr. Wipf right after we take this break. Potential patients for their employee doctors in various clinics around the... Why wouldn't they look at this as sour grapes on your part? That, man, you're just a little miffed that they're taking potential business away from you and making your bottom line look a little skinnier than it would have otherwise, and say, you know, this guy's just crying in his beer because he's not getting as much business as he used to.
Well, that's true, Bob. I'm not getting as much business as I used to.
Well, I mean, so the thing is, what really makes it, you know, worthy of intelligent, rational discussion?
Okay, Bob, let's look at before and after. 2 years ago, these clinics weren't even in the valley. Okay, you had 60 chiropractors who were giving good service to patients coming in, having very dismal care by and large from medical clinics. So everybody got a little bit of the 300 or so car accident throughout the valley every month. Now what's happened, when in those days, if you were in a car accident and a week later you started to have some neck pain or some headaches, you could make a decision based on your decision-making ability whether you wanted to see your private physician, whether you wanted to visit me or any other chiropractor, as a matter of fact, any other healthcare provider. But that was a decision that you made. You weren't rushed.
You can't still make that decision today, though?
It's tougher because right now, as I said, I've got patients who are telling me within a week ago they were in a small fender bender and they got 12 telephone calls, 6 of them from attorneys and the other 6 from chiropractors.
What you're saying is people need to change their telephone number immediately after having a traffic accident,
well,
right? Is that what they have to do?
They need to hang up when they're talking to these
people. How about
people.
call forward? How about caller ID? Is that what they need to have? Just to kind of put these people at arm's length?
They tell them who they are. Yeah. Okay, if you talk to them long enough, you'll find out who they are, and they'll tell you where to go, either to an attorney's office or to a chiropractor's office.
Why not just put it on a recorder? I mean, the thing is, I guess people can avoid a phone call if they want to, right? I mean, we've all gotten schooled in the electronic age that we know how we can kind of avoid a phone call.
I don't think it's a matter of avoidance. I don't think it should be happening anyway. See, as I was saying, before this became an issue, Bob, people would make a decision on their own. And if they needed any medical attention, they usually made it on their own, or they would get a referral from friends or family. Now, within 24 hours of an accident, you're going to have a multitude of very high-pressure salespeople call you, and they're being paid, I've heard, anywhere from $100 to $300 for every patient that they bring into the chiropractor or attorney's office. Now, with that kind of pressure, one-to-one, the average person can't really make an informed decision. What we're talking about is informed consent to treatment. Right now,
I mean, what's the answer, though? I mean, the thing is, now we've laid out a major problem here, at least as far as you're concerned. In your eyesight, this is a serious problem.
Very serious.
And the question is, though, does it require legislation?
Yes.
Or does it require, I mean, does it require people to be, hang up on these people when they get them on the phone? In other words, I guess I'm one of these people. If somebody started in on a pitch with me, I hang that phone up. You know, and I dare them to call me back. If they call back, I hang that phone up again. And the third time, I'd rip that phone out of the wall, and they'd never talk to me for the rest of the day.
But, Bob, you have confrontational skills, and you're articulate.
Well, don't give me more credit than the average person. There's a lot of people out there who don't mind being confrontational.
No, that's right. But, you know, the average guy, after an accident, I mean, he's still a little stunned, okay? He's a little confused.
Woozy, maybe.
Yeah, I mean, he might be taking some old pain medication out of the medicine cabinet from when his wife had a surgery or something. Yeah. And he's not, or she is not able to make an informed decision. And from what I understand, they're calling and they're saying they're representing themselves as the insurance company, directing them to go to the office.
That's misrepresentation.
I think
Would you call that lying?
I call it fraud. Okay. But they're telling them to go to Dr. So-and-so at such and such chiropractic clinic for a medical evaluation to determine medical legal liability. I mean, that's what it's come to. And I believe that's fraud. And that shouldn't happen. And yes, we should have legislation. The same legislation that lawyers are subjected to, where chiropractors or really no one should be calling an accident victim within 30 days of the accident. Give them time to settle down, get their head clear, and make an informed decision. And if they need to seek care before that, they can do it on their own or with what resources are within their family or their family physician.
You heard that from Dr. R.J. Wipf. And we'll be back with Dr. Wipf in a moment. Stress because of accidents and what they should do and what they're being forced to face in this onslaught of solicitation from people representing insurance companies and chiropractors and representing apparently anybody who wants a piece of somebody when they're down and possibly out, right?
Right.
Now, what should the average person out there watching this show do if they are unfortunate enough to be in an accident and let's say they have minor injuries? If there's major injuries, they're obviously going to be taken to the hospital and they're going to be stabilized. They're going to have a medical doctor look at them and evaluate them, and if they need, I guess, some chiropractic help, they will probably get it, you know, at that point of contact, right? But if there's a minor problem, that people can walk away, shake it off, and they can't shake it off, what should they do? What is their course of action?
Well, Bob, whenever you give medical advice, you know, generically, it's all medical advice.
Okay, this is just generic guidance. This is not medical advice. This is generic guidance about what somebody should do.
Right. Well, if the attendants at the scene of an accident feel that it's appropriate and prudent for that injured victim to go to the emergency room, that's certainly what they should do. And then they should take the advice of the health caregivers at the emergency room, and those are medical doctors. But again, in the emergency room, what they're looking for, Bob, is life-threatening injuries. They're looking for airway problems, breathing problems, circulation problems, you know, bleeding and hemorrhage, you know, cerebral spinal fluid out of the nose, ears. This is stuff.
Or cracked bones, right?
Yeah, or fractures, things that that are very readily observable by physical examination or x-ray.
And they also want to stabilize them to the point where they don't have a crisis.
Right. And if that's the case, they'll be hospitalized or given whatever medical attention is appropriate. Now, about only 10%, maybe 7, 8% statistically does that happen. The other 90% are discharged with recommendations to see their family physician or other health caregiver if symptomatology should continue beyond that which is helped by simple aspirin or home remedies.
Or Tylenol or something else like that.
And usually after an accident, within the first half day to day, the adrenaline is so high, unless it's very serious, people don't feel that. But just like after a hard game of tennis or football, it hurts the next day, not the day that you participated.
Or the third day.
Or the third, or the fourth. That's right. So the second, third, or fourth day, when the victim is beginning to feel the symptoms, headaches, neck pain, wherever they were injured, then my advice is to seek care from your family physician. And in many cases, your family physician is your chiropractor. I've got a lot of patients who only see chiropractic with the exception of trauma or infections or immunizations, this type of thing.
Would it be fair to say that you would like to put out of business these mass solicitation companies and these clinics in the valley that use this technique? Would it be fair to say you'd like to put them out of business?
That's right. You know, before they came...
But won't that increase your bottom line then? I mean, to some extent?
I'll be able to regain my bottom line.
Oh, okay.
That's right. Well, you know, I'll be frank, Bob. Before these companies came down about 2 years ago, I was seeing about 25% of my total volume in accident victims. And they were coming to me because of referrals and because of our advertising. And internal
word of mouth, too.
Word of mouth, yeah. And now it's only maybe 2-3%. You know, it's real tough to be competitive.
But now you can't make a living just off accident victims, even if you didn't have all this competition, can you?
Well, let me put it this way, Bob. When you go into an emergency room, the average emergency room visit in this country is about $800, okay? And the average soft tissue injury, which is 90% of accident injuries, runs about $2,500 to $3,000 per injury. These clinics, and I've talked to doctors who have worked in them who no longer work in them, they take in up to 40 to 60 patients a month and are seeing 80 to 100 patients a day. And their case values, as far as the total care that's given, run anywhere from $4,000 to $6,000 per case.
But in the meantime, the people aren't getting true service, though, are they? If they're being mass handled this way, mass produced along an assembly line like this, they can't be getting the kind of service they need to recover from an accident, right?
Well, I can't say that for sure, Bob, because I haven't been there, but I can tell you this. If a doctor of chiropractic is seeing 80 to 100 accident victims a day, and from what I understand, 95% of their patient load or population is accident victims, I'll compare that with in my clinic. We have an average of 10 doctors in our clinic. Our average chiropractic patient load is about 30 patients a day. And we have a mix, where, as I said, now we're down to about 5% personal injury. We do maybe 20-30% work comp, and we also see Medicare patients, Medicaid patients, and cash patients. And to give you an idea, you asked me whether it's profitable to see personal injury patients. When a Medicare patient comes in to see me, he pays for his own x-rays, his own examination, and Medicare only pays a reimbursement of around $18 per visit. Our visit charges $20 and only pays about 12 visits. So, i.e., the total case fee on most Medicare patients is under $300. When you compare that to the average national case fee of a personal injury case at being $3,000, well, that means a personal injury case is worth, in economical sense, 10 times more than a Medicare. So, see, in the past...
So that's why there's this drive to pick up this accident.
That's right, very lucrative.
As opposed to Medicare or Medicaid business.
Well, figure it out, Bob. If we just say each one of these clinics, say there's 8 of them here in the Valley, if they're seeing 50 new patients a month, 50 times an average of $5,000 per case average, that's $250,000 per month with that one doctor. The average chiropractor in this country serves about $25,000 per month, and from what I understand, the average medical doctor does about $30,000.
So we're talking big money here, aren't we?
Well, that's about almost 10 times the billed fees than your average chiropractor nationally.
We'll take a break. Dr. Wipf, our guest, we'll be right back. Thanks for being with us. We'll see you next week on Borderline.
This has been Borderline with your host, Bob Gilmartin. Borderline has been brought to you by the International Bank of Commerce. We do more. McAllen Medical Center. Dunkin' Donuts of McAllen. Osmond Appliance. The McAllen Foreign Trade Zone. Wipf Chiropractic and Microtel Inn. Tune in again next week for Borderline.